welcome back. It's still Health Talk here on AETV Live with Ogaga Ekama, and the conversation is on tuberculosis. And I am with Dr. Adeze Eze, a public health specialist from the Federal Medical Center, Asaba. And of course, we've talked about what tuberculosis is, the risk factors, those persons predisposed or at risk of contracting the TB, and of course, the signs and symptoms. So now, Dr. Adeze, you were talking about the different symptoms. Now, good news is that for those persons down with the infection latent stage and all of that, there are no signs, no symptoms, and the person can continue all through their life without getting down with the disease and all of that. Then you broke it down. I like the fact that you talked about pulmonary. Is it pulmonary TB now?
Yes,
and
TB.
Extra pulmonary TB. So now the pulmonary TB is the one that affects the lungs, then the extra other parts of the body. It's quite interesting to know that, growing up, when you hear TB, the first thing comes with cough and lungs. But from what you've explained, you've talked about it can affect the urinary tract, abdomen, the spine. And I'm like, okay, so is that the same way one contracts the pulmonary TB that this extra pulmonary TB still contracted? The same way?
Yes.
So what influences where it's affected, the organ that is affected?
Okay. So TB is usually airborne. So when someone inhales the bacteria and then it gets to the lungs, sometimes the bloodstream can carry it from the lungs to the other organs. So that's how it moves to those organs.
Okay.
And then,
So now let's talk about the diagnosis and the test. So now when somebody finds out that you are down with any of these symptoms you've mentioned previously, when a person gets to the hospital, what tests or diagnoses are done for this person?
Okay. So usually when someone presents to the hospital, there are lots of investigations the person has to pass through. So some of them are done to detect TB. Then some other tests are just done to assess the individual's well-being, know their baseline, what their baseline is like, and then know how to manage the person. So now the tests that we do specifically for TB are, we have the gene expert. So it's...
Gene expert?
Yeah, gene expert, yes. So it's...
GENE.
Yes, then SPERT. So it's usually done with sputum. So if the person is able to cough out sputum, they test it and then find out if the bacteria can be detected in that sputum. So it's a test that we do a lot and it doesn't really take a lot of time. 2 hours, 3 hours, the result is out.
Okay.
Then we also have another one that is called the sputum AFB. It's also a sputum test, and then the bacteria is the sputum is we are trying to still find the Mycobacterium tuberculosis in the sputum as well. But then it's another type of test. We also do a sputum MCS, and TB can also be detected through the sputum MCS. So another investigation we can do is chest X-ray. So everybody that comes to the TB clinic has to do a chest X-ray at first, because it also helps to analyze the extent of the damage that the TB has done. It will also help to find out if there are complications already ongoing. Then we also do it during treatment to be sure that what we are giving the person, what the drugs the person is taking is working. So apart from these investigations, we also do, we can do a full blood count, because we want to know what the blood picture is like. We do something.
Wait, so the full blood count, is it to know the volume of blood in the person's body, or what was it?
Okay. So yes, it will help us know how many red blood cells the person has. It will also help us know how many white blood cells the person has. So white blood cells is helping to fight the infections. And in this case, most people with TB will have an elevated white blood cell count.
Are you serious?
Yes, because they are, in this, white blood cells are fighting the infection. Yes. So the person has an infection ongoing. So the body tends to produce more of it to fight the infection. So Although there are lots of things that can present with high elevated white blood cells, but then it's one of the pictures we see with TB. Then other tests we can do, there are other tests. We do a fasting blood sugar. We even do HIV tests. It's also important because most of the people that come down with TB most times are HIV patients. So it's important to do a HIV test. One of the reasons why we do the fasting blood sugar is also to assess that the person is not diabetic, because diabetes is also one of the risk factors for developing TB. Then other investigations we do something we call that one is not commonly done here, but then there's something called the line probe assays as well. Then in cases of TB of the spine, an MRI, that's a magnetic resonance imaging, can also be done, or a CT scan can be done to view the bone. Then sometimes there might be need to aspirate. Maybe someone has something called pleural effusion, which is one of the complications of this TB. There might be need to aspirate. That's more like put a needle and get the fluid in the lung, in the covering of the lungs. Then it is kind of cultured, and then if TB is there, it can be detected. So there are lots of investigations that can be done. However, the commonest one we do to detect TB is the gene expert.
Okay. So I don't know if somehow we've touched it, but are there stages of this infection or disease?
Okay. The stages are still okay. So we have the primary TB infection where the mycobacteria comes into the body. So that's like a stage that everybody passes through. So it's like
for the latent infection.
Yes. Okay. So now some people just when they are exposed to this bacteria, it goes into their body. So now some people go into another stage, which is the latent TB. That's the second stage now. So
primary latent.
Yeah, so it's just like that. Then after the latent, you can go into the active. But then there are people that once they get into so in some cases, some of them end as the latent. Nothing happens afterwards.
Okay.
Then some people, it just progresses straight to the active TB disease, which is chronic.
Okay, so you've said a lot about diagnosis and the test. Now, let's talk about prevention. Okay. Because if it's one of the most, and according to the WHO, not just one of the most, it's a world's top infectious killer. So it's pertinent that we talk about how it can be prevented, because millions of persons die with TB or are killed by TB every year. So how can it be prevented?
Okay, so the prevention of TB is actually the most important aspect of everything about TB. So now, one way of preventing TB is vaccination. There's a vaccine called the BCG vaccine that is given to babies immediately they are born. So it's very important that every mother, every parent vaccinates their baby. Like before you go home from the hospital after delivering, it's very important that they vaccinate that baby before people, because we all know how we all love babies. You go home and then everybody's carrying your child, kissing the baby, and they could have TB. Another method of preventing this disease is screening. So early diagnosis, that's early screening. So it's important that anybody that has coughed for at least for 2 weeks and above should get screened immediately. Because if they are screened, now let me paint a picture. Imagine someone has just coughed for 2 weeks and then they present to the hospital and get screened and then commence treatment. They won't spread it to as much people as they would have if maybe they have suffered from the disease for 6 months, or if they have been coughing for 6 months. So early screening or early diagnosis and treatment is also another way of preventing the spread of TB. Then another way of preventing this TB is proper ventilation. So it's important that people stay in houses, work in offices that are well ventilated. So people should avoid overcrowded places, and then they should stay in places that are well ventilated. So another method of preventing it would be proper cough etiquette. So if someone is having cough, it's important that the person practices proper cough etiquette to avoid spreading this infection to other people. So what do we mean? We mean when you're trying to cough, you should cough into your elbow if you don't have a handkerchief. Well, then if you have one, you should cough into a handkerchief or a tissue paper. Avoid just opening your mouth wide open and coughing into the air. Then, apart from that, it's important that people who are high risk are protected as well. So now, people with HIV diseases and other diseases that predispose people or put people at risk of developing this disease, there's something called the preventive therapy that can be given to them. So it's also a method of preventing TB in these people. So they are usually given some medications that helps them prevent this TB. The other people, that's the healthcare workers that are usually exposed to people with TB, can also be placed on these medications that can prevent against TB. So these are basically methods that you can prevent the spread of TB.
All right. Dr. Adeze Eze has listed some ways which TB can be prevented. We'll go for a short break, and when we return, we'll look into the different ways TB can be prevented in detail.